Alright, here are my supplies for the barium enema. I have 1,600 milliliters of room temperature water. I have my gloves. This is the contrast that I'm using. I have the lubricant jelly, a cuff to inflate, the barium enema kit. I have the gown for the patient. I have the chucks in case any contrast leaks out. I have a 45-degree sponge and an IR holder. I have my IV pole and my barium bag. And now I'm going to go get the patient. Tyler?
Yep.
Hi, my name is Landon. I'll be assisting the radiologist in the barium enema today. Can you confirm your last name and date of birth?
Schaefer, 7/25/05.
Okay, and then do you know why you're having the barium enema today?
I've just been having stomach pain.
Okay, have you had any previous abdominal surgeries?
Nope.
No? Have you ever had a barium enema before? Okay, have you ever had used contrast before? No? Okay, if you feel uncomfortable during the exam, feel any burning sensations or itching, let us know immediately and then we'll stop the exam, okay?
Okay.
Before we begin, I'll have you change into this gown. You're going to change everything from the waist up, including any jewelry, that name badge, and then I'm going to have you use the restroom as well, and you're just going to empty your bowel and bladder the best that you can. So then after that, we'll have you lay down on the table. We're going to get a first image just to see what that looks like. The radiologist will come in and look at that. And then we're going to have you roll onto your side. That's when we'll insert the tip here, which will introduce contrast into your intestines, and that just kind of highlights everything that we want to see. And then after that, we're just going to kind of have you roll around in different positions and get all the pictures that the radiologist wants, okay?
Sure.
Do you have any questions? All right, I'll have you go into that bathroom right there, everything from the waist up, okay?
Sure.
And then use the restroom as well. Come out when you're ready.
Yep, I'm ready.
All right. I'll have you come on over here. Go ahead and lay down on this table for me. All right, so for this first scout image, we're centering at the crest. Our field size is going to be open 14 by 17, and our SID is going to be 40 inches. Just gonna feel around here. Good. Marking the left side. Marking the left side. Okay. Just hold still right there. Okay, go ahead and hold your breath. Exposure. That technique is a 16 at 80. We want to see the large intestine with no bowel. All right, Tyler, we're going to insert the tip now, so I'm going to have you roll up onto your left side for me. Go ahead and bring your right leg over your left leg. Okay, we're going to insert the tip. It's going to go 1.5 inches in and then 1.5 inches up to follow the colon. I'm going to bring the IV tube over here. The bag will be no more than 24 inches above the level of insertion. Okay. All right, Tyler, go ahead. You can roll onto your stomach. We're centering again at the crest. 14 by 17 field size, 40-inch SID. My tube is still lined up. I'm marking the left side. All right, Tyler, stop breathing. Exposure, that technique is 32 at 80. We want to see the large intestine, and we want to see that the barium is in the transverse colon. All right, we're going to center at the as is. For this next one, we're going to have a 30 to 40 degree caudal angle. I'm going to line up my tube. Centering on the as is, marking 14 by 17 field size. Okay. All right, Tyler, hold your breath. Exposure, you can breathe. That technique was at 50 at 80. We want to see the sigmoid and rectosigmoid colon with less superimposition because we put that angle on there. All right. We're going to do the RAO next. I'm going to put this sponge under you here. Going to roll up. Go ahead and lay back down. Okay. I'm going to take my angle off of my tube. Centering at the crest and 1 to 2 inches lateral to the elevated side. Lining up my tube. I'm going to mark this side down. So I'm going to mark the right side. Okay. All right, go ahead and hold your breath. Exposure, that technique is 50 at 100. We see the entire colon, and then we see the flexure on the side down, so the right colic flexure, and then we also see the ascending and sigmoid colon. All right, for this next one, if the room allows, which ours does not, we would do a right lateral to cube. So I would go ahead and grab my IR holder over there. I would take my image receptor out. He would be laying on his right side, and I would center at the crest. Okay, Tyler, go ahead and hold your breath. Exposure, that technique would be 50 at 100. We see the area from the flexures to the rectum, and the medial side of the ascending colon and lateral side of the descending colon. All right, Tyler, go ahead and roll back onto your back. We're going to do the RPO next, so go ahead and roll up onto your right side. I'm going to put this sponge under you. Go ahead and lay back down. We're going to center 1 to 2 inches lateral to the elevated side again, at the level of the crest. Marking this side down, so I will be marking the right side. 14 by 17 field size, still 40-inch SID. All right, Tyler, go ahead and hold your breath. Exposure, that technique is 50 at 100. We want to see the entire colon, and we want to see the left colic flexure open, and we want to see the descending colon. All right, I'm going to go ahead and take that sponge out. Have you roll up onto your left side. Okay. For this one, we're going to center at the as is. I'm going to line up my eye over here. Just going to have you kind of roll forward a little bit. I'm going to mark the left side. And this will be a 10 by 12 field size. All right, Tyler, hold your breath. Exposure, you can breathe. That technique was 110 at 140. We want to see the rectum and distal sigmoid colon, and we want to see that the hips are superimposed. All right, Tyler, we're going to go ahead and remove that tip now. So the tip is removed. We're going to drop the bag down on the ground. All right, Tyler, go ahead and use the restroom and try to empty your bowel and bladder the best you can. And then we just have one more image that we need to take, okay? So go ahead and let me know when you're ready.
Okay, ready.
All right. So one more image here. I'm gonna have you roll back onto your stomach. We're going to center at the crest. Just gonna feel here. Line up my tube or my feet. Open my field size back up to a 14 by 17. Put my marker on there. Okay, 14 by 17 field size, 40-inch SID centering at the crest. All right, Tyler, hold your breath. Exposure, you can breathe and you can relax. Technique is 32 at 80, and we want to see the entire colon with no minimal to no barium left. All right, Tyler, we are all done. You can go ahead and relax here. I'll move this out of your way. I encourage you to drink a lot of water within the next 48 hours to really wash out that contrast. Don't be alarmed if it comes out white. That is very normal. If you don't have a bowel movement within 48 hours, you should contact your physician. And if you have any other problems, you should just call them, okay? All right, we're all done. You can go ahead and change out of that gown and change into your regular clothes, okay? Okay, thanks.